and it looks a very easy treatment to have done, having watched the demonstrations, because I think a lot of people have put off PRP as a concept by having seen those pictures of Kim Kardashian a few years ago, having what's popularly called the vampire facial, where she looks as if she's got her face covered in blood. But that's not quite what was going on there, was it? I mean, she had PRP done, the plasma taken, but we think it was needled into her face, and the needling produced all the blood. Could you just clarify a bit on that?
Well, I mean, I'm just going to say that what you're about to watch upstairs in the 2 masterclasses, actually what you watched earlier with Cheryl Marshall-Williams, you couldn't see a thing after both treatments, and both patients stood up, walked out the door. You couldn't tell. Yeah. And Zan
not even a needle mark after endless points. Yeah.
I think if Kim Kardashian did that, there'll be no PR impact.
There'll be no story.
As well. And I say that with the greatest of love and respect for that. So I think there was a mechanical injury also associated with that, and it could have been something like microneedling, or it could have been a laser therapy, etc. I do not want to comment, because that's not fair. And we do a lot of that as well, combination therapies. We do microneedling, and we use PRP with that. We do that in the scalp, the skin, the face. We use other treatments as well, like the hydrofacial Keravive, just to clean the scalp, and then we embed. So, yeah.
Thank you. I just think there's a tendency when something's popped up on the Kardashians' feed to trivialize it and think it's some silly celeb fad. And I think the point about PRP, particularly the Regen Labs machine and the cell matrix here, is it is deeply serious and incredibly well proven, and there's an awful lot of science behind it.
Here you can find a lot of scientific studies.
Oh yeah, they literally wrote the book.
Yeah,
wrote the book on it.
Showing the effectiveness of the treatment for hair, face, dark circles, periorbital rejuvenation, perioral rejuvenation. So we have a lot of things. Yeah. And Matrix, this one is quite new. The idea, so we know actually that it's really effective for the face, but we are trying to prove that it's also effective for the scalp and for hair restoration. The study is not finished yet, but we have some result, and we know that it works really well.
Okay, so this really is cutting edge science. Yeah, yes. Fantastic. And are you involved in this study?
In a slightly different study, so I'm very
You'll
interested.
be putting all the different bits together as and when it comes through, I'm sure.
Dr. Sandrine's study. So the study that we've been doing has actually been looking at the Saluma by Patrick Johnson and his team. And what the Saluma does is it uses light. So we've been carrying out a study on Andrew, who you will meet today, and he's had 3 to 6 months of just pure light therapy to help his hair stimulation, and we'll showcase his results in 10 minutes. And what we've done yesterday, we've done his first ever session with PRP. So we'll now look at his progress with PRP alone, and we're studying his pictures not purely on visuals. We've been using Nick Sinclair's Canfield hair analysis device. So we're not just looking for the
measuring,
visual.
yeah.
We've been measuring Andrew's results with his hair imaging since November last year. So we'll be coming up to 1 year in November this year. So it'll be interesting to see how the blend has gone.
Very exciting. Sherina, Sandrine, thank you so much.
Thank you.